Hello, YouTube, and especially the enhanced bodybuilders that have helped me with my research and any others that might be listening. This is just a quick video to get your feedback on what I'm intending to present at a symposium in Australia on Friday. Sorry for the short notice, but that I'm also planning on publishing in the not too distant future. So please provide your feedback. Tell me if I'm saying something stupid, if I'm missing something out, that sort of thing. All right, here we go. Oh, sorry for my voice. I'm a snot factory at the moment. Hi, my name's Maya Underwood. I'm an anthropologist from the University of Queensland, and I work with enhanced recreational bodybuilders. And today I want to talk to you about their perspectives on the issues we're discussing in this symposium, particularly blood-borne viruses. I think we can all agree that safe injecting practices should be encouraged. But what I'm here to talk to you about today is how we might want to go about this, as I think some efforts, although well intentioned, may have unintended consequences. I think we could also agree that health promotion messages must tap into the meanings and experiences of the target audience in order to successfully change their behaviour. Today I'll describe the existing meanings of blood-borne virus in the recreational bodybuilding community and suggest how they might inform the reception of health promotion efforts. I've been working with enhanced recreational bodybuilders for about 3 years now. By recreational bodybuilders, I mean bodybuilders who don't intend to compete in the sport of bodybuilding, but rather are doing it for purely social reasons. I use the term enhanced rather than people who inject PIEDs because it's less of a mouthful, but more importantly because that's what they call themselves. And as an anthropologist, I'm about conveying the research participants' perspective. My focus during the last year has been on how enhanced bodybuilders understand the risks of their PED use and the harm minimisation efforts they have come up with themselves, as some of you may have seen me talk about at last year's APSAD conference. Today I'm drawing on my research, which has been largely online, but also had offline components, including face-to-face interviews and lifting weights, including with participants. I've interviewed 22 enhanced recreational bodybuilders and 5 experts who advise them about ways they can minimise the harms of their use. I have ongoing contact with most participants, some as often as weekly and sometimes daily. Interestingly, only one participant, an expert involved in providing clean injecting equipment, mentioned blood-borne viruses when asked about the risks of PED use. All other participants listed many risks of PED use, but blood-borne viruses were not considered a significant enough issue to warrant mentioning. So in preparation for this presentation, I approached them about this issue specifically via email, messenger, or Wicker. Some of them were quite surprised that I was asking about blood-borne viruses, and some were actually insulted for reasons I'll go into later. In bodybuilding and steroid forums, blood-borne viruses are rarely, if ever, mentioned, and in the few instances I found where Hep C was discussed, the thread was about how to use steroids safely if you had already contracted Hep C from other recreational drug use or tattoo practice. Other than the one expert I mentioned for whom blood-borne viruses were a significant issue, the remainder of the participants described blood-borne viruses as not a concern or as a non-issue. They gave numerous reasons why blood-borne viruses were not a significant issue for them. First and foremost, all participants stated that they use clean equipment and practice low-risk injecting through washing hands before and after, swabbing vials and injection sites, and disposing of needles safely. The vast majority described their PED use as a solitary practice. They typically don't use with other people, and if they do, they don't share needles. They rarely even reuse their own needles, and they practice very clean injecting. Many will not use a needle unless they open the packaging themselves. Even if someone opens a needle in front of them, they will still refuse it. These practices are informed by little or no desperation to use the drugs, thus greatly reducing the chance of risky injection practices. As Bjorn states, he is in no rush and has plenty of time to source clean equipment. Jack explained how his steroid injection differed from his opioid injection, stating that it tends to be desperation that informs risky injection practice. While they were not really concerned with blood-borne virus, as it was a risk they prevented, they did have injection-related concerns, such as poor injection technique that could lead to abscesses or bacterial infection. They were also concerned with post-injection pain and methods to reduce it. As Jack explained, users care about what's most likely to happen every time they inject, even if the consequences are low, as opposed to what could cause death but may happen once in a billion shots. While they are concerned with risks posed by injecting practices, they are most concerned about the life-threatening long-term risks of PED use. There are numerous health risks of PED use that are regularly discussed by enhanced recreational bodybuilders and other people who use PEDs on forums and social media. They are primarily concerned with the life-threatening risks such as heart health, cholesterol, liver function, blood pressure, and high hematocrit levels. As discussed at last year's APSAD conference, in the absence of state-provided harm minimisation strategies, they have come up with their own strategies to minimise these risks, such as regular blood testing and subsequent changes to use patterns, doses, or ancillary drugs should levels be concerning. Often healthcare providers will not facilitate this blood testing, so enhanced recreational bodybuilders will use private labs, some of which they even fund themselves. Unfortunately, I have to gloss over these findings because of time constraints today, but feel free to ask more in questions. As I also pointed out at last year's conference, from the enhanced recreational bodybuilder's perspective, PED risks are more than just physical. They are also mental, social, sexual, and occupational. Furthermore, the boundary between harm and benefit can be blurry and dynamic from the enhanced recreational bodybuilder's perspective. Rarely do academics and healthcare providers consider the complexity of PED risk, which gives us a very narrow view of PED-related harms and of the decision-making process that enhanced bodybuilders undergo. It is this narrow perspective on PED risk that I now turn. When academics and healthcare providers focus on blood-borne virus, enhanced recreational bodybuilders feel that this demonstrates an overstatement of the risks of blood-borne virus, and they even make reference to the published academic literature to support their view. Ignorance with regards to the actual practice of PED injecting, and therefore the actual likelihood of contracting blood-borne virus through PED injecting. Ignorance of the range of risks and avoidance of the complexity of the topic of harm minimisation, and therefore a failure to deal with risks that are more likely and often more significant. And finally, generalising across all people who inject drugs. This is, unsurprisingly, offensive to enhanced recreational bodybuilders who describe themselves as health conscious and driven by self-improvement. Enhanced recreational bodybuilders see the focus on blood-borne viruses as misplaced, and they see this as having significant consequences. Firstly, it makes for ineffective services and puts users off engaging with health services because they do not provide relevant information. And secondly, it increases existing divides between bodybuilders on the one hand and healthcare workers and academics on the other. Enhanced bodybuilders such as Bjorn describe the resulting disconnect between themselves and healthcare professionals and academics. A divide between bodybuilders and the medical community has long existed and stems from the fact that the medical community denied that anabolic androgenic steroids were effective at building muscle as recently as the year 2000. Bodybuilders knew the effectiveness of these drugs for many decades prior to this and concluded that the medical establishment did not know as much as they did about these compounds. Wally stated that in recent years this divide may be lessening a little, especially with more open-minded young doctors, but that a focus on blood-borne virus risks undoing this progress, lessening this divide. If our current emphasis on blood-borne virus has unintended consequences, perhaps it's time to rethink our approach. Participants certainly thought so, and one, Mason, even made a suggestion of how we could go about this. He suggested focusing on infection more generally rather than on blood-borne virus, and in so doing we could reduce blood-borne virus without risking stigmatizing people who inject performance and image-enhancing drugs. All of the participants suggested that they would like a focus on the risks that mattered to them, that were much more likely to eventuate than blood-borne virus, and which had the potential to be just as serious or even more serious than blood-borne virus. PIED use does increase blood-borne virus risk if behaviours like needle sharing, unhygienic practice and improper disposal occur, but none of the participants in my research practiced these behaviours. From what I have found, enhanced recreational bodybuilders actively work to minimise the harms of their use, often at significant financial expense. They are not risk takers who have no concern for their health and who are ignorant of blood-borne virus risk. I do acknowledge that my study is based on a small sample, as is the norm with in-depth qualitative research, and that the enhanced recreational bodybuilders I spoke to may not be representative of the entire community. Those that volunteered to participate in my research were well educated and middle class, as are most people who inject performance and image-enhancing drugs. Furthermore, as I did not pay them to contribute to this research, they participated because they understand the benefits of research. Indeed, most rely on the scientific literature to inform their use. I'm certain that there are other enhanced bodybuilders who take greater risks and are less well informed, although if the blood-borne virus literature is anything to go by, they are in the minority. Harm minimisation strategies, while well-intentioned, may exacerbate harms. By focusing on blood-borne virus, we may minimise the effectiveness of harm minimisation strategies and exacerbate existing divides that currently prevent many enhanced bodybuilders from seeking help and from contributing to research. Therefore, I think we need to listen to the concerns of enhanced bodybuilders when we strive to reduce the harms of their PIED use. So, thanks for listening. Sorry for all the snot clogging up my voice and for me stumbling over a few of the words. I've actually got 15 minutes to speak, so I can add some stuff in if you've got any suggestions. Those of you that have already talked to me, you might recognise your own words in this presentation, although I've given you a pseudonym. I hope I've done your perspectives justice, and I look forward to hearing what you think. See ya.